Hello, general psychology students. So this is going to be the last video to cover chapter 4, states of consciousness. And what we're going to be talking about in this short video are the drugs. So let me share the screen and we'll get to the PowerPoint slides that we'll be covering. So we're going to begin talking about drugs. And so psychoactive drugs are drugs that influence a person's emotions, their perceptions, and their behaviors. And the thing about the psychoactive drugs is that oftentimes it leads to tolerance. So tolerance is the situation that sometimes after you've been taking a drug, you'll need more of the same drug in order to get the same effect. So maybe you need 3 milligrams for a while to have a certain change in your mood or perception or behavior. But over time, now you might need 4 milligrams or 6 milligrams because you've become tolerant to the drug. Your body will need more to give you the same effect. And because of tolerance, our level of how much or the amount of drug that we need can increase and increase so that at some point we can become physically dependent on the drug. Physical dependence means that your body craves it. And if you are not given the drug, you're going to have some physical changes to your body. We call those withdrawal symptoms. So when you stop taking the drug, you withdraw from the drug, you're going to have some symptoms. And we'll talk about some of the different withdrawal symptoms for different drugs. But if you have withdrawal, then you know you've got physical dependence on that drug. There's also psychological dependence on a drug. So this is where your body may not crave it, but you do psychologically. Like you're like, at the end of the night, I just need to do this one thing. You're psychologically dependent on the drug. All right, so we're going to talk about 4 different types of drugs: depressants, stimulants, opiates, and hallucinogenics. So let's talk about depressants first. So the depressants are drugs that work by slowing down your nervous system. Okay, they're going to cause the neurons to fire more slowly. And the most common depressant is alcohol. Now, small amounts can lead people to feel joy and euphoria and have decreased inhibitions. So sometimes it doesn't feel like a depressant. It almost feels like it gives you more energy, but it's not. It's just decreasing your inhibitions. And in larger amounts, you can really see how it's a depressant. You get slurred speech, decreased muscle control, loss of consciousness, oftentimes really poor judgment. And because of that poor judgment, alcohol can cause a lot of problems for people. They end up spending more money on something than they would have. They end up maybe having sex with someone that they wouldn't have had sex with. Had they had their wits about them more. And maybe they, put themselves in situations that are more compromising than they normally would. And so those can all be effects of alcohol. And then alcohol in really high doses can cause alcohol poisoning and even death. So alcohol, even though it's legal, is actually pretty dangerous in a lot of ways. It leads to physical and psychological dependence. And when people who are dependent on alcohol withdraw from it, stop drinking, if they do it suddenly, the withdrawal symptoms can be so bad that even withdrawing can cause death. And so we call it the TDs. People will have tremors and delirium when they stop having alcohol if they're physically dependent on it. And so if someone does have a problem with alcohol, they are dependent on alcohol and they want to stop, most of the time, if you're going to go cold turkey, you want to do so with the medical establishment around you in the hospital or something where you're given something to help you deal with the withdrawal symptoms because they can be pretty severe. So let's talk about stimulants now. So these are drugs that have the opposite effect. They're going to cause a rise in your blood pressure, your heart rate, your muscle tension. These are going to make you more alert. They're going to stimulate you. And of course, the most common one, legal, is caffeine. It increases attentiveness, decreases reaction time for things, but it can make you feel nervous and keep you from sleeping if you have too much of it. And some of the withdrawal effects include headaches. How many of you on a Saturday morning, if you're you're used to drinking coffee every morning and then a Saturday you sleep in and when you wake up you have a real headache, that might be withdrawal from caffeine. Also, withdrawing from caffeine can make people feel kind of down and depressed. Other stimulants, nicotine, it raises the dopamine levels in the brain and tolerance develops. It's highly addictive. Anyone who smokes cigarettes for any amount of time can talk about how easy it is to get addicted and how hard it is to quit. Withdrawal symptoms for nicotine include irritability, cravings, increased appetite, having a hard time sleeping, inability to focus. It's a whole bunch of things. Cocaine is an illegal stimulant that's out there. It blocks the reuptake of dopamine. And I've never tried it, but the people that I've talked to have tried it say that it makes you feel really good. You can almost see sometimes people's drug of choice has to do sometimes with the disorders that they have. So people who suffer from depression, sometimes they'll really be more likely to use the stimulants. They'll be more likely to use cocaine or caffeine. People who are anxious are more likely to use alcohol or something that's going to calm them down. Amphetamines, including meth, it can bring a feeling of euphoria and increase the heart rate and blood pressure, but it can cause hallucinations, paranoia. It alters the normal brain functioning, especially after repeated use. And some people can become dependent on amphetamines after only one use. So those are some drugs. All you need to do is just see some YouTube videos about methamphetamines and just watch a video or two. And I have no desire to even think about trying it. It just seems horrible. Okay, this is crack rock. So this is crack. It's a very dense form of cocaine, and it's much easier to be physically addicted to crack than to even regular cocaine, which also has a very high rate of dependence. So. Okay, another set of drugs are called opiates, and opiates are great at decreasing pain. Unfortunately, they have a really high tolerance quickly and a high ability to be dependent. People become physically dependent on them quickly and can become psychologically dependent on them also. However, after surgery, this is oftentimes what the hospital will give you because it's so good at reducing your pain. And so I'm sure we've all met someone who, after surgery, was given some kind of an opiate like Oxycontin and codeine or something like that. And then over time, they became addicted to it and, really had trouble and had to, see specialists to get them to slowly reduce the amount of the drug that they were taking. Heroin is also considered an opiate, brings an initial euphoria followed by agitation, and the withdrawal symptoms are so bad that people really seek out the heroin over and over. So those are the opiates. And then the last set of drugs that I want to talk about are the hallucinogenics. And these are drugs that result in profound alterations in sensory and perceptual experiences. You're going to see things differently or feel things differently. For some reason, marijuana shows up on this list. I think it's because oftentimes people who use marijuana will say that it makes them feel better. Like if they're tasting something, they'll taste even better than it normally would. If they're looking at a sunset, the sunset looks even more beautiful when they're high. And so I think that's why it probably fits in this category, because to some extent it's altering your sensory or perceptual experience. Marijuana is a drug that's hard because in some states it's legal now. It does intensify sensory experiences, but it really harms your memory. It's not physically addictive, but some people think that it's psychologically addictive. And over time, it can change your brain chemistry. One thing it definitely does is lower your testosterone production. And if you're smoking it, it can cause lung damage. One of the disorders associated with marijuana that's talked about sometimes is the amotivational disorder, which means that you just lose motivation to do anything. So it's like you're not doing anything bad, but you're not doing anything good either. You're just not doing anything. You sort of lose your motivation. You just want to get high all the time. In some states, it's legal. So I know I've had many conversations with people who live in a state where it's legal, saying that marijuana is safer than alcohol. And so in Oklahoma, while marijuana remains illegal, I think a legal substance is always going to be safer than an illegal one, just because with an illegal one, you don't really know what you're getting. But that's marijuana. Some more severe or more less controversial, because they're really seen as hallucinogenics, are ecstasy and LSD and PCP. And all of those are highly addictive. And again, drugs that I don't understand why anyone would fool around with them. All you need to do is YouTube video, asking for LSD or ecstasy or PCP, and you will get people who became addicted to them very quickly and really lost all of the good things in their life, or a good portion of the good things in their lives, and wish that they had never even tried it in the first place. So ecstasy, LSD, PCP, all illegal, all lead to hallucinations, and they're highly addictive. Definitely ones that I would recommend not trying. And then here's some psychedelic images that are often associated with the hallucinogenics. And we are done with the States of Consciousness chapter. So if you have any questions, just email me at maryd@cameron.edu. And next week, we'll be talking about lifespan, human growth, and development. Have a good week.